Hello, and welcome to the Office of Research Regulatory Affairs Research Matters. I'm Scott Myers, the Clinical Research Educator for UT Southwestern's Office of Research Regulatory Affairs, and I will be one of the moderators for today's session. If you have any questions for our presenters during today's session, please type them in the Q&A, and one of the moderators will respond to you during the session, or we will address it at the end of the presentations. This session is being recorded, and you can watch it again right after it's finished by clicking on the Microsoft Teams live link in the email invitation. We'll also send you the slides via email. You can find the links to future meetings, slides, handouts, and past recordings on the HRPP's Research Matters website under the Training and Resources page. We do provide a certificate of attendance for those who have logged in using a valid email address. If you do not receive one via email, but should have, please send an email to hrpp@utsouthwestern.edu to request a certificate. Lastly, we want to hear from you. We use the information you provide to plan for future topics for these sessions. It's also an opportunity for you to let us know how our speakers did and how our office is doing. So please take a few minutes to complete the survey to provide your feedback. You may access the survey using your phone via the QR code or your computer by selecting the link. I will also drop the link for the survey in the Q&A. All right, here is our agenda for today. First, Letitia Blea, the Director of Research Operations and Finance at Parkland Hospital, will speak to you about updates to the Parkland exhibit requirements for data sharing from Parkland Hospital to UT Southwestern. Then Mayad Bird, our IRB Director, will provide updates from the Human Research Protection Program. Next, Mayad Bird and Manali Thakur will discuss the updated good clinical practice training requirements, transition plan, compliance checks, and the highlights of some key updates on the new guidance. Then, Wiam Ali from our Quality Assurance and Monitoring team will present on study initiation reviews, a quality assurance and monitoring educational initiative which aims to positively impact compliance from the outset of a newly activated study, while also providing study staff an opportunity to discuss, learn, and obtain tools and resources relevant to their study. Finally, if time permits, we will conclude with an open Q&A session. Okay, so we will go ahead and get started. Mayad, I will turn it over to you.
Thank you, Scott. Let me get my screen shared. All right, good afternoon, everyone. It's good to be here. Today I have one update for you. So I wanted to kind of talk to you all about a project that our office, alongside with the Cancer Center and Sponsored Program Administration, have been working on. If you remember when we were migrating studies from EIRB to Ethos, we hit a snag. The snag was related to funding information. So with the revamp and redesign of the Ethos system, we wanted the ability to pull in e-agreements, e-grants directly into Ethos so that we could have a better opportunity to verify current funding information. Well, when we migrated studies from EIRB to Ethos, there was something wrong with the e-agreement, e-grants configuration in Ethos. So we had a difficult time adding the current funding information. So to keep the migration efforts moving along, what our office did is that we assigned the department for which the PI worked under as the funding source. And there was communication that was sent out to research teams that, hey, we have this error. Please look at your funding information and correct that information if it's incorrect. I think on quite a few studies, we found that that update has not happened. And this caused kind of a big concern for the institution with regard to studies that have clinical research or clinical procedures being done for research purposes. It's this sort of thing caused kind of a nightmare. So I'm going to talk a little bit about kind of the funding information and now how important it is to make sure that we've got funding information listed correctly in Ethos. So first things first, I want to talk about why we ask for funding information in ethos. Obviously, this is something that the IRB needs in terms of when we are applying federal regulations to a study. For example, if a study is federally funded, we want to make sure that we're aware that federal funding has been allotted to this study so that we can apply the appropriate federal regulations. Having correct funding information in ethos also helps the IRB review when and determine when IRB review fees are for the study is fee eligible. It also helps us as an institution understand who is responsible for costs. And that information is important and comes over to the informed consent document. So that's something that we want to make sure that participants understand that they may be responsible for a cost or they're not responsible for costs. When we think about this from a system integration standpoint, Ethos is now the source of truth with regard to institutional funding source. The information, although it does come from e-agreements and e-grants, if those are applicable to Ethos, Ethos is then the source of truth for information that gets fed into Velos, and then in turn it gets fed into Epic. By us creating the schedule of events. And obviously that's going to align with the clinical trial agreement whenever there's, again, clinical research procedures that are billable. Why this matters to the institution? Obviously, compliance and billing and accuracy is probably the primary issue of why it matters to the university. We want to ensure that billing in Epic matches contract terms and funding source. We want to make sure that we're not incorrectly billing Medicare, Medicaid for procedures that should be covered by the contract or the research agreement. And then it obviously reduces risk of improper billing and audit findings. From an operational standpoint, it provides transparency of costs across the IRB grants, contract, and billing offices. It helps align study documentation with financial agreements and participant billing, and ultimately strengthens institutional accountability and protects research participants. So all in all, it's very important that we have funding information aligned. So I have a snippet right here of the funding information within Ethos. For arbitrary purposes, I've selected all types of funding sources just so that we can see kind of what populates and what's branched based on the selections. So obviously, if you've got external funded grants and contracts, you're going to have a funding proposal and award that populates here. If your study involves a research agreement, then you're going to be asked to add the e-agreement ID here. Gifts, you can add them here, but those actually don't get fed into Velos. If the study is funded by maybe the department, an institution, then you're going to identify that as internal departmental funding. And then obviously you'll have to select that information in this portion of the application. External funding that's not managed through UT Southwestern and Sponsored Programs Administration. I can give you a couple of examples. This is going to be like, for example, we are the IRB of record for THR. Obviously, their funding is not managed by the UT Southwestern Sponsored Program Administration. So from this page, obviously, you're going to select the appropriate funding source, and then you're going to classify the type of funding. Again, this is the key component here that helps us understand IRB review fees, what federal regulations may apply to the study. I'm sharing this and I won't cover it in detail, but obviously, hopefully when we send out these slides, you'll get this information. And this is just some funding tips. This is how to classify examples of funding that you may be receiving. So for example, you could have external funded grants and contracts. This is what you should be selecting, or the possibilities of the items that you could be selecting on section 4.0 item 1. And I've provided some examples of those types of funding sources. Again, I won't spend time talking about that. I'll let that be available as a tip sheet when the slides become available. So ultimately, when you select your funding source, one of them is the funding source. And again, this is going to be the funding source to which you charge any type of clinical research billable procedure. So again, that's the information that needs to be fed into Velos. Okay, so remember that when you're selecting funding sources and what you're selecting as the primary source of funding, again, that needs to be the one that's selected so it gets fed into Velos, and in turn it gets fed into the Epic. This is also a diagram that helps share the how the funding source is tied to Velos. Again, I won't go over this. This has been made available in some research tip sheet material when we first transitioned to Ethos, but it's also here because it's really, really important that we identify the primary funding source, again, because that does come over to Velos. And again, Ethos is the source of truth. And I think, yeah, I think that's all that I have with regard to the funding update and HRPP updates. I'm going to turn things over to Letitia, and then I'll come back and visit with you all to talk about the information that Letitia is going to be sharing today.
Thank you, Mayad. Let me just get my screen populated. Bear with me as it keeps, there it goes. Okay. Good afternoon. Again, my name is Letitia Blais. I'm the Director of Research Operations and Finance here at Parkland with the Department of Research Administration. Thank you for this opportunity to update our research community. Specifically, we're going to be focusing on how Parkland and UT Southwestern are further operationalizing research data sharing, what has changed, the latest master data sharing agreement and corresponding data acknowledgement form, and resources to help you with this. I'll start with the agreement landscape, then the data classification guide and the general rules of the road, and close with the process workflow. What you see here is the general relationship as far as Parkland and UT Southwestern are concerned. We have a long-standing research partnership with multiple agreements in place specific to research. The overarching is the research affiliation agreement that serves as the umbrella and governs our overall research relationship between Parkland and UT Southwestern. We have 3 other sub-agreements referenced in the RRA. You're likely most familiar with the Clinical Research Services Agreement that addresses the financial aspects such as research fee schedule and invoicing, and the Research Credentialing Agreement that addresses UT Southwestern non-physician study staff that will have contact with Parkland patients or medical records or other systems. Our newest is the Master Data Sharing Agreement for research. With the Master Data Sharing Agreement that was just fully executed last month, we are standardizing how data is shared between our respective institutions. So this will not necessarily be new information, but it is updated and looks a little bit different than it has in the past. So what we have first under the affiliation agreement is these 4 buckets of data and how we're classifying the data across the board. You're most familiar with your informed consent and HIPAA authorization, where the patient is signing and acknowledging that their information may be shared for the existing study with other collaborators or for future studies. You have your de-identified data, which does not contain any of the 18 HIPAA identifiers. Most commonly, we see the mistake where a date is identified that actually falls into a limited data set. So with a limited data set, you may have dates such as admissions, discharges, dates of birth, zip code, and then you also have protected health information. For the limited data set and for protected health information, there is a requirement for an IRB waiver or alteration of the authorization. So with that, and with the master data sharing agreement, if there is written authorization, it is not required to have this acknowledgement form that we'll share a little bit further with you. For de-identified data, you're not required to have this acknowledgement form. You can think of this in terms of your standard data transfer and use agreement, which is what we were using earlier this summer and then previously with third parties. With limited data sets and with protected health information with direct identifiers, a contractual arrangement is required. With the Master Research Data Sharing Agreement for research, this is a simple 1-page exhibit that's going to identify basic information related to the study. This would streamline the overall process since it no longer has to go through the formal contractual systems. For Parkland, that is Jagger. For UT Southwestern, that is e-agreements. We have worked in coordination with our UT Southwestern counterparts at TechDev, SPA, as well as the IRB to facilitate and transition. But we want to make sure that you are aware of what those requirements and rules of the road are going to be. We have already operationalized this, so some of you may already have seen this information and know exactly what needs to happen. We want to make sure we get this out to the greater community. The rules of the road have not changed. As a reminder, Parkland is an opt-in institution, meaning that a participant, a patient, must opt in to participating in research. If you have a written authorization, then they are acknowledging, yes, I would like to participate. For a large volume of our research activity, however, there is not the written authorization, which is where we come into play with the IRB and some of the additional detail that will support those efforts, as well as Parkland Research Administration. Your primary usage is limited to that approved study at the time that you're submitting for performance site approval. Other usage, again, since we are an opt-in institution, is limited to your original study approval. If you have written authorization, you have already included language in that written authorization for future use. But as I mentioned, for the greater volume of research data requests, you must remember that it has to be limited to just that research study. If there is in fact a breach, of course, we want to ensure there's appropriate security mechanisms that are in place. There is a formal contact as far as Parkland is concerned. Historically, we have not had an issue, but the systems are already in place and individuals will contact the Parkland Research Administration. In terms of sharing, this is reflected within the IRB ethos environment, and I'll go through that. And I know Mayad's going to share that a little bit further. But we just want to make you aware that any type of sharing that is identified, again, has to be identified within your IRB approval, as well as signed off by Parkland as a part of our site approval. So in terms of the overall workflow for going through, we first are notified within our Research Ops and Finance section of Research Administration. Generally, this is a part of your performance site review process. Or we'll have some principal investigators that we work with that 2-3 years down the line, they've identified that they want to collaborate and share with another entity. They will notify our office that this will be performed, this activity, and we will now utilize this one-page exhibit versus a formal data transfer and use agreement. We verify and align this information across ethos with the study summary, the data specimen sharing section, and the waiver alteration of informed consent section. We also cross-reference with the REDCap data request form that is required as a part of submitting for performance site approval. Once we've gone through and done this verification, reminder that you must ensure that you have the necessary required approvals from IRB and Research Administration. Our office will complete the data recipient acknowledgement form, again, replacing the multi-party and single-use data transfer and use agreements. It also identifies any collaborators in alignment with what was authorized by the IRB and Parkland approval. It's important to note that pass-through terms and conditions must be applied to those final individuals. In terms of the signatures, it'll be submitted via Adobe eSig with sent to the principal investigator, the faculty sponsor if applicable, and the Parkland VP of Research Administration. Once it's finalized, the final assigned exhibit will be transmitted automatically to the signatories as well as to the research coordinator and Parkland Research Administration. As a best practice, highly recommend that as a study team member that you file this document in Velos or some type of central document location. And then if there are any questions as you're going through this process, Make sure you reach out to any one of us. This is a new effort to hopefully streamline the overarching exchange of data. We will have more communication, more training that's going to be available, but we wanted to make you aware of this new development and respond to any further inquiries in the future to help you be able to focus on your research in a compliant manner. Thank you.
Okay, I'm going to take things over and hopefully just kind of describe the process and kind of how we plan to work with Parkland with regard to this requirement. So what I want to mention from an IRB standpoint, since there is a data sharing agreement between the two institutions, as an IRB, we need to make sure that we are being consistent with that data sharing agreement because the information is coming to UT Southwestern and we don't want to violate again the components of that research sharing agreement. So some of the things that we're going to look at and I want to just kind of convey here and, just be ready to update your applications to be more specific about the level of details that go in there. So one of the things we're going to focus on is whether the data that is being collected on the study, if it's coming from Parkland, either collected, disclosed to UT Southwestern. So we're going to look at that because that's just a factor for the IRB to consider. I mean, because obviously there's more questions that we have to ask and answer. We want to know what type of data will be extracted and disclosed to UT Southwestern. So in your application, you want to make sure that you're thorough enough so that way we can link up any agreement with what is actually occurring with the protocol. And what we're trying to do is avoid a situation where we might have to go back and update any of your IRB application and or agreement details with Parkland, especially if there's a situation where you thought you were collecting only de-identified information, but now it's maybe a limited data set. So again, be more specific in your protocol and ensure that you disclose and provide the IRB with the information that's going to be collected. We're obviously, alongside with the other considerations, we're going to be looking at whether the study involves a HIPAA authorization or whether the researcher is requesting a HIPAA waiver. We want to address whether the data that's collected and disclosed to UT Southwestern will be further shared beyond UT Southwestern. Again, in that scenario, we want to make sure that the exhibit has detailed who the data is going to go to, because again, we want to make sure that Parkland Research Administration is aware and agrees to any type of data sharing. As I mentioned before, I mean, even though this is an institutional requirement of Parkland, being the IRB of record, we want to make sure that we somehow comply with some of those institutional requirements, again, because we're trying to think about things from an efficiency standpoint. What makes sense? Does it make sense to have cycles and cycles and cycles of modifications, or does it make sense to strategize and find a process that will allow us access to the information we need from an IRB standpoint and allow Parkland the information that they need to be able to execute these documents? So we haven't finalized exactly where to place this document, whether it goes into Ethos or Velos or some other platform. So the HRPP office will be continuing to work with Parkland to find the best location for that exhibit document. Again, because from the IRB standpoint, it behooves us to ensure that we have some recollection of what's being shared, and especially at the time when things change and data sharing changes. So I just wanted to comment on that from an IRB standpoint, what we're going to be doing to help ensure that there's compliance with regard to this new requirement. That's all that I have for now, and I will be turning things over to Manali. No, actually, it's me. Sorry. Let me get my screen switched. I forgot that I'm presenting first. So next up on our agenda, we have the GPC, Good Clinical Practice Updates, E6R3. And Hopefully everyone can see my slide here. So as you probably may know, I think some of you have been reaching out to our office to find out what are we going to do with GCP E6R3? Are we adopting it? What are we doing? And I think there's some pressure from sponsors to require that the research coordinators at our institution where we're conducting clinical trials, that they have this updated R3 training. So today we're going to talk about good clinical practice, what our requirements are, and kind of where we go from here. So just to kind of begin with, the UT Southwestern policy is one where we do follow GCP training requirements for studies that involve drugs or devices. I would say that the IRB doesn't apply the ICH GCP standards as a blanket requirement for all human subject research. And instead, again, we only apply this particular requirement when the study involves drugs or devices, or when you're conducting an NIH-funded clinical trial, or research personnel involved in a clinical trial would need to have this type of training. The IRB recognizes that some sponsors, networks, cooperative groups may impose GCP requirements as a condition of participation. And in those cases, while the IRB doesn't enforce sponsor-specific mandates, investigators are expected to comply with them to maintain funding and collaborations with those sponsors. So that's kind of what I wanted to share with regard to the applicability. Next, we have the training resources. So as an institution, we subscribe to CITI program, and one of the modules available at CITI is the good clinical practice. We learned that as of October 27th, they will be updating their modules to include GCP R3 starting October 27, 2025. They've added this course as GCP refresher training. So new users that initiate that GCP training after this date will have the R3 compliant modules incorporated in them. So again, from an IRB standpoint, we're only extending the GCP requirements as far as the FDA requires. But if you are required to complete GCP, especially having that R3 updated compliant module, if you complete CITI training and that GCP refresher after October 27, 2025, you should be considered compliant because, again, the CITI modules will have the updated R3 modules in place. I know that before this date, some of you might have tried to access a CITI program and they might have said, hey, we need to collect some money from you. But again, because we have a subscription with CITI program, it would be made available after October 27, 2025. And again, this is because the FDA has adopted the same requirements. That's all that I have. I'm going to turn things over to Manali to talk a little bit about how to register, get some instructions down, and then talk about some key changes or key updates in the modules 3.
Thank you, Maya. Thank you for the detailed instructions. Hello, everyone. I am Manali Tucker, and today I will cover the how-to instructions and just a few key updates on the new R3 guidance. Okay, so the process of completing training via the CITI modules is the same as adding any other CITI course. You will log in with your UT Southwestern credentials, select UT Southwestern as your affiliated institution, and thereafter select Add a Course. CITI will ask you a bunch of questions which you can just respond as not at this time. Just the GCP modules should be selected. So as you see in this screenshot over here, if you have taken GCP training before, just select the GCP refresher. And if you're new, you'll select the GCP basic course. After that, you just complete the modules and be sure to save a copy of the completion certificate for your records. All right. So here I have tried to put together a few key changes as it relates to the duties and responsibilities of the investigator in the new R3 guidance. Now, once you take the city module course, you will get a full coverage training, but this is just my small effort to highlight the changes that could impact your daily workflow. So the first one is about data and systems. The R3 update adds a specific emphasis on the timely review of trial data. So this isn't just about if you review it, but when. It's about reviewing data as it comes in a timely manner, especially from external sources like central labs, variables, or any other outside entities where your data or specimens is being sent. So it's important to note that certain milestone events like reviewing safety labs, assessing AE severity, or any labs that result that affect inclusion, exclusion criteria, etc., will be looked at from a standpoint of was this timely assessed. Second, we have new duties for computerized systems. This directly addresses all the new tech in our trials. It means that we must ensure that the sponsor-provided systems are used as specified, that we can properly train participants on any devices like e-diaries. And this is a new key point that we could report that the study teams need to report system incidents that could affect data integrity. Now, let's talk about investigational product. This is a notable operational shift. The new language allows the sponsor to facilitate IP management. This formally opens the door for decentralized clinical trials and now officially talks about like new study designs, like shipping the IP directly to a participant, a local pharmacy, or other healthcare center. Now, with this new flexibility comes a new responsibility of risk-based oversight. The R3 guidance moves away from a one-size-fits-all approach to IP accountability. It says that the level of oversight should be proportionate to the risks. I feel this is a positive change. It empowers you as the investigator to apply your own critical thinking and determine the appropriate level of oversight for your specific study. On this one, we do see changes affecting participants and your study team. Talking about informed consent elements, there are two new required elements for the consent discussion. You must now clearly explain the follow-up procedures for participants who stop the IP or withdraw from the trial, and how their data will be handled if they do withdraw. Next is the new guidance allows for the delegation of safety reporting to qualified staff. On the study team side, there's a helpful clarification on delegation. So that's a good positive note. Now, while this is great for our workflows, the guidance is still very clear to say that the investigator will still retain the overall responsibility for participant safety and monitoring. So as always, the best practice is to delegate, but also make sure you verify the information. All right. The specific timeframes for record retention, we might be used to seeing the 2 years timeframe. It has now been removed. The new standard is flexible, it's a bit more complex, but you must now keep records for either the time required by applicable regulatory requirements, that means FDA, state, or local rules, or until the sponsor no longer needs them, whichever one of those is the longest. The impact here is that this puts more responsibility on us at UT Southwestern. We are expected to know all the applicable retention rules for every single study and not just the ICH guidance. Okay, skipping over to the references slide. This brings us to the end of my quick overview. Thank you so much for your time today. I know this is a very high-level summary of some big changes, but we're here to help you and your teams navigate this. We'll be happy to take any questions in the Q&A, and I will now move this over to my colleague William and she'll be talking about the SIR reviews.
Hello, everyone. Thank you, Manali. Hello, everyone. I'm Wiam Ali, a regulatory monitoring analyst within the UT Southwestern Quality team. Today, we'll be presenting the study initiation reviews. We refer to them as SIR reviews. This type of review is implemented recently within the quality team. So we'd like for you to learn about it and understand the purpose of the review. So the study initiation reviews are a QIM educational initiative. They aim to positively impact the compliance from the beginning of the study. And this review will provide the study staff with an opportunity to discuss, learn, and obtain tools, resources relevant to their study. In addition to that, it will give us an opportunity as a quality team to implement preventive measures for any potential failures in study workflow, pitfalls, non-compliance, and/or serious violation that could have negative consequences or impact. Selection criteria. So how we determine study eligibility for a study initiation review. If the study is approved by the IRB and newly activated, and if it's an investigator-initiated trial, like no matter if it's the PI is local or external PI, that means the study is eligible for SIR review and might be selected for to be reviewed. We have, with the study initiation reviews selection process, we have a different level of priorities. So always the high priority will go to the study where we have the PI as the IND IDE holder, where the study is testing a new medication or investigational drug, and for greater than minimal risk studies. And when we have like a multi-site study, and the UT Southwestern PI is the lead PI. So the moderate priority level will goes to studies where we have where the UT Southwestern is not the IRB of record. We have a multi-site study, but the UT Southwestern PI is not the lead on this one. And lastly, the rest priority will go to studies where we have minimal risk determination. Just to let you know that for greater than minimal risk studies and minimal risk studies, we have a list of documents that we expect the site will maintain and like in their documentation. This list of documents we always share with the site when we reach out to them to schedule like a visit. But in case if you want to have like a list of those like documents needed for a greater than minimal risk and minimal risk, you can always reach out to us at hrppmonitoring@utsouthwestern.edu, and we'll be happy to share a copy with you. So now what to expect? So we have, now we start like the preparation for the visit. So we have three steps that we follow when we prepare for a study. Like we have the preparation process before the visit, we have the during the visit, and we have after the visit. So now we're discussing before the study initiation review, the preparation. So the first step will be to send a scheduling email to the team, and we determine the time and the date, depending on, of course, on their availability. We will determine the time and date, and then we discuss with them the opportunity to conduct a remote review if they have everything stored electronically. If not, then we conduct in person, and we ask for the study for the site location. We inform the study team of the expected duration of visits. It's going to be for those type of visits 3 to 4 hours. Maybe it will be extended depending on the data load they have at the site. We always request that the primary study coordinator be available for at least 1 hour, and the PI availability is preferable as well, between like 30 minutes to 1 hour during the visits. Just to note, whenever you receive a request for a site initiation review, please do not disrupt or pause enrollment or study activities at the sites. Continue as usual and as normal, and we'll accommodate the visit date depending on your availability and depending on your requirements. So now we have the visits already scheduled, so it's time to conduct the visit. So when we conduct the visit, we will have two situations. So we either have the study activated, approved by the IRB, completed the initiation process, but we don't have any patients enrolled yet. So in this situation, during the visit, we're gonna have a meeting with the study PI and the study coordinator. We will discuss the workflow with the study team. We will ask them hypothetically to explain the process of recruiting a subject, like screening a subject, enrolling the subject, and how to conduct all procedures related or required by protocol, starting from the beginning of the study to the end. And we'll discuss with the principal investigator the PI responsibilities. We'll discuss with them some UT Southwestern policies and give them some guidance on how to maintain regulatory documentation and provide them with the regulatory templates if needed, answer any questions they may have, and we will conduct like a full regulatory documentation review just to make sure that the site maintain good documentation in terms of like delegation, making sure that all site members are trained as required per protocol, and there is a training documentation. And with the other situation where we have enrollment, so we will be conducting the same process, like discussing all the study workflow, PI responsibilities. We review the record, like regulatory records. But since they have enrolled patients, then we will pick a small percentage of the total subject enrollment, and we'll review study documents and source documents for the subjects. And in that case, we will make sure like they have a good source documentation, they're following Alcoa principles, and at the end of the review, we will gather all the findings. We'll discuss it with the study team. We will discuss with them recommendation or resolution, or give them plan of action, make sure that we assure them that we're going to be available whenever they need us to for explanation for any of the findings. And the next step will be to send them like all the findings in a report, and that's going to be after the end of the visit. So as I mentioned, when we discuss everything with them, we inform them that they will receive all the item discussed, like all the findings in a report that we refer to it as an action required report. That action required report has a 2 weeks window, and during those 2 weeks will be available to the team in case they have any question, need assistance via Teams, via email, via phone call. Once all items are resolved, then we send the final letter to the team acknowledging resolution of all items. In case if we completed the review and we don't have any findings, then we proceed right away with sending a final letter or report just to confirm that the site has no findings. And that would be the end of the review. Very important to note that all those like audits or reports, they're internal, so they're not required to be shared with external entities. You can file them separately from the regulatory documentation. So that's the end of it. If you have any questions, just let us know through the Q&A chat. Yeah, thank you for attending. I will turn it over now to Scott.
All right, everyone, we have concluded the presentations, so we're going to move into an open Q&A session. So I invite you to submit any questions or comments that you may have at this time. While we wait for you to get those questions typed up, I did need to make a quick correction about something I've said earlier today in my introduction and something we've done in the past. So for now, we are no longer going to be publishing the actual slides for these presentations on our website like we've done previously in the past. They are going to be emailed to you via the listserv. If you don't receive those, or if you want those, you can use that hrpp@utsouthwestern.edu email to request that. However, the video recordings of these sessions will still be published on our website. So again, videos, recordings are going to go to our website, but right now we are no longer publishing the slides on our website. Also, while we're still waiting for some questions, just a reminder about the survey. You can find a link to the survey in the Q&A. And also here you can use the little QR code as well. We really appreciate your feedback. So if you do have a few minutes, please go ahead and provide that to us. Okay. Okay, so we have one question now. That question is, so the SIR needs to be scheduled after obtaining the IRB approvals and green light. Is that correct?
Yes, they should be scheduled after. We're not going to select the study for SIR review unless it's approved by the IRB. So we're not going to proceed with any scheduling unless you have an IRB approval. Yes, correct.
What about green light, Liam? IRB approval is one thing, or study activation is, I think, the question.
Yeah, so they have to have a study activation, and then
Gotcha.
and they have their green light for enrollment, and then we will reach out to them after to schedule the SIR. Otherwise, we'll not be reaching if they don't have the green light.
Thank you.
I'd like to add something over here. So I understand we talk about reaching out to the study teams and scheduling it, but the study teams are also open to reach out to us if they have a new study that just got activated and they do want an SIR to be done. Please feel free to reach out to us. Our email is hrppmonitoring@utsouthwestern.edu. Just send us your STU number and we'll be happy to come out and do an SIR for your study.
Okay, I have a couple more questions right now to go through. First, I think this is related to the data sharing with Parkland. Will mods for studies sharing data between Parkland and UT Southwestern require an updated research data acknowledgement form, or only if they change the data sharing?
This is Letitia. So in response to mods, what we're doing right now is all net new studies that have a limited data set or PHI are being done first. We are also now reviewing those studies that we are actively provisioning data to set up the exhibit. And then concurrently, as mods are coming through, we are reevaluating and assessing if there's a limited data set and PHI. So there's a multi-prong approach that's going on right now.
Thank you. Another question, I think this is an ethos related question. How do you change an IRB title in ethos via modification?
So after you initiate the modification, the main smart form, you should be able to toggle to the main smart form and update the intake question. So that would be the way that you would modify the study title.
Thank you, Mayed. Okay, I'll give you all just another minute. We don't have any questions at the moment, but there's still time. So if you have any, please go ahead and type those up. Okay, I don't see any new questions. So I think we can wrap up. I want to thank all our presenters and thank you all for attending today's session. Our next Research Matters is scheduled for November the 18th. So thank you all, and I hope you have a great rest of your week.